Today's scheduled project with a few key facts. 1. Boom. A femoral artery is one of the major arteries in your thigh that comes up and through your groin. 2. An angioplasty is a surgical procedure in which a catheter is used to open a section of a narrowed or blocked artery. 3. A stent is a metal mesh device in which it opens and holds open the affected section of artery. Also, when the stent is placed into the body grows tissue around it and takes it in as one of its own. Please enjoy this project by Christina Card, me, and I hope you enjoy.
Come in. Hi, I'm Nurse Card. I heard you had some questions for me.
Yeah, the procedure that I'm supposed to get, the angioplasty.
Angioplasty.
Oh, okay, what is that?
So you're getting a procedure today called a femoral artery angioplasty. They're going to stick a catheter into your femoral artery right by your groin, and we're going to lead a wire up to your blockage that you have. And there's going to be a balloon on the end, and it's going to inflate and help flow. And they're also going to place a stent in there.
Oh, okay. And why do I need that?
So the reason for the angioplasty is because you have a blockage that is cutting off blood flow. And because of this, your heart and everything is not getting the amount of blood or oxygen that it needs.
And how long does it usually take?
So the procedure can last just a couple of hours. You're gonna get a sedative, and you're gonna be awake, but you're gonna be real relaxed, and you're gonna lay on an exam table, and the doctor's gonna be able to monitor your arteries and everything through live x-ray imaging. They're also gonna inject some contrast so that they can see your arteries in the camera, and the balloon that they're putting in is going to have contrast in it as well so that they can see the blockage and watch the stent being placed.
And what's going to happen afterwards?
So afterwards, depending on how they close it, you're going to have some hours of bed rest. Sometimes we even do an in and out procedure, so it gets done and you can go home. But I see here in your chart that you have a few things going on with you today, so you may be looking at an overnight stay.
And once I get this done, I'll be cured? I don't have to worry about it again?
Actually, it seems that stents fail within 1 to 2 years afterwards, which is not a big deal. They're just a foreign object inside the body, so we're going to go ahead and in a couple of years we'll keep checking on you regularly, and in a couple of years if it needs replaced, we will do the procedure again, where they are putting the catheter in and inflating the balloon and sliding the stent over, and the stent stays in place.
Should I be concerned about this procedure? Is it life-threatening, or any medications? Because I don't like opioids. I don't want to become addicted to them. So is there anything that I should be worrying about?
So most often there's not too much pain. I will want you to monitor for pain afterwards, but we'll probably give you some Tylenol, and we may put you on blood thinners just to prevent any clots that might happen. You're most at risk for clots within like the first month after. Your recovery time is probably going to be like 4 to 6 weeks. You also will be exposed to a little bit of radiation, but it's nothing intense. Nothing that you should probably be worried about.
And this procedure is safe? It's not life-threatening or anything like that?
With every procedure there are some risks. However, you have a very good doctor, and he's going to take very good care of you.
And is there anything that I should be aware of afterwards? Like any symptoms, anything that I should watch out for?
Okay, so after your procedure, you are going to have some swelling on the side that the procedure is on. The swelling could last a few days to a few weeks. It's nothing to be concerned about unless it gets really big and just doesn't go away, or your skin starts to change color. You need to be on the lookout for warmth in the area because that could be a sign of infection. Also, you need to watch for bleeding. You need to watch for any kind of abnormal drainage. You need to keep it dry for the first 24 to 48 hours after the procedure. Just making sure that you're doing good wound care so that you do not get an infection in your leg. You need to monitor yourself for pain. If you are having any increased pain or abnormal pain, feel free to contact your provider and we can get you some pain medications.
Okay. Thank you.
You're welcome.